Well, while we were talking about allergies, I wanted to talk about scarlet fever. In my experience, scarlet fever is absolutely the easiest disease in the world to cure. I'm talking about a few hours. Now, scarlet fever is caused by an allergic reaction to strep toxin. And usually, the strep is gone by that time. Usually the person has had something like a strep throat or some infection of the skin or something which has been treated with penicillin or some other antibiotic, and the strep is dead. But there is a residual amount of strep toxin left in the body that the body has an almighty allergic reaction to. Well, my experience is that when a patient comes in with this typical rash of scarlet fever, that you give them ascorbate, and if you give it intravenously, within a few hours the rash is gone, and it's permanently gone. You see, the thing is that with most diseases, you've still got a little bit of the bug left inside making the toxin still, whereas in this case, the toxin is all gone. Once it's neutralized, that's it. Now, since I have not seen a case of rheumatic fever, I would assume that the same thing would happen. Since rheumatic fever is another allergic reaction to strep toxin, then the ascorbate will neutralize the strep toxin. Now then there's the treatment of beta hemolytic strep. Now, I have had this type of thing happen to me twice while I was up at Incline. A mother would bring in their 6-year-old kid and say have a bad sore throat, and I was suspicious of strep, so I would do a throat culture and give them a prescription for some penicillin orally, and tell them how to take the vitamin C and the probiotic, the acidophilus, and then send the child home. And then 2 days later, when the culture came back, the beta hemolytic strep, I would call the mother and say, well, how's Johnny? Oh, he's all well, he's back to school. I said, well, you gave him the penicillin, didn't you? And they say, no, we were waiting for the culture, we just gave the vitamin C. So now, for legal reasons, I would, if I knew it was strep, I would not dare not use vitamin C, not use penicillin, but there's some question in my mind still whether or not it's necessary and whether or not ascorbate will take out the strep all by itself. Maybe it will, maybe it won't. For legal reasons, I'm not going to make a definite statement about that. But I think it would be an interesting thing for investigation.